Coming up next on Functional Moms Podcast. Dr. Neda, what are things we can do today to improve eye health and age strong?
Follow a Mediterranean diet. As basic as that sounds, that is one of the core fundamentals of ocular support, whether it's from the front of your eye to the back of your eye. Following a standard, classic, good Mediterranean diet where you hit all your vegetables, your fatty fish, your healthy fats. Number two, I would say give your eyes a break. So take breaks. For people who are constantly on computers, indoors, use nature to your advantage. Go outdoors, take visual breaks from what you're staring at. And number three, do you even know what your ocular status is? Do we even know what the health concern is in your eye? Because different parts of the eye may have different recommendations. So getting a routine eye exam, even if it's basic, is better than nothing.
Welcome to Functional Moms Podcast, lifestyle medicine for women over 40. Let's age on our own terms. This episode is for you if you would like to learn how hormonal changes during perimenopause and menopause impact eye health. Studies from the American Academy of Ophthalmology show that women are more likely to develop certain eye diseases like age-related macular degeneration, cataracts, glaucoma, and dry eye.
Dr. Neda Gioia is the founder and owner of the Integrative Vision, an optometry practice in New Jersey focused on nutritional interventions and functional medicine strategies to optimize eye and overall health. A practicing optometrist for nearly 20 years, Dr. Neda is currently the only nationally board certified OD in both nutrition and functional medicine.
Dr. Neda is the immediate past president of the Ocular Wellness and Nutrition Society and serves on the board of the New Jersey Society of Optometric Physicians. She's recognized for creating service-driven innovations such as C Health and her award-winning Eye Exam Plus program.
Dr. Neda, we are thrilled to have you on the Functional Moms Podcast. And I have to say that I saw Dr. Neda for my eye health exam, and it was the most comprehensive eye exam I have ever had in my life. And I am 58, people. I would like to ask you if you can explain how menopause impacts eye health, because I felt that, I am a fully menopausal woman, and I felt like that a lot of the findings that we had with my eye exam were connected to being a menopausal woman. And so I would love for you to explain the impact and menopause in eye health.
I would be happy to share all of that. And I wanted to first start with saying thank you for having me on your show. I know we have met quite a few times now, and
Yes.
I do appreciate the work that you guys are doing, the awareness, really bringing community together and kind of interchanging all these disciplinaries together and putting it all under one platform is really awesome. And I'm more than honored to help represent the ocular health side in this type of conversation. So yes, happy to be here. And yes, you are right, Raquel. There are certain conditions that have a higher prevalence in females than males, especially in the aging female. And, one aspect of that is that we don't even discuss that discrepancy much. And, just to put a highlight on one major condition, which is called dry eye disease, that is 2 to 3 times more prevalent in women due to hormonal fluctuations and most likely autoimmune discrepancy too. Autoimmune is sadly another condition, umbrella that women really have a higher incidence of. So, just looking at it from that one disease, that's a lot of people, right?
Yes.
And going back to some of the conversations that we had yesterday, absolutely. Some of the underlying root causes for, dry eye is hormone imbalance. And I have to say, everything we do clinically or, in our careers, I'd never stay the same because I just like change. I like to, learn and see all the new research. And I also like to see gaps, meaning where do we have the answers and where do we not have the answers? And I'd love to say that, I have all the answers for you today with how hormone imbalance affects all the ocular tissue going from the front to the back of the eye, and talking about all the receptor differences and, the genetics behind that, and, how we can see a mechanism of action that's different between our male and female patients. And we're not there yet, but we know that this is a place of necessary research,
Mm,
the whys. And then on top of that, are we missing a whole way of treatment too? So
mm,
you see, like, so there's a lot of steps here
right.
where the awareness can domino effect to finding treatment plans or treatment ways to help these patients improve their ocular health. But yes, there are certain diseases, even macular degeneration. Now, there's twofold for women. One is, do we have a hormonal difference that's causing that discrepancy? Or number two, is it because women have a longer life expectancy as well to some degree? So, for example, age-related macular degeneration is slightly higher as a percentage in females. The question is that because of the extended age that females typically have versus their male counterparts. It's probably a mix of both.
Right. Can we pause there for a moment? I would just like to peel back a little bit. If you can, just for those of us who do not know, what are the symptoms of macular degeneration? What is macular degeneration?
So, in simple terms, we have a part of the back of our eye in the retina, it's called, and it's a very specific part called the macula, which absorbs the most amount of light rays that give us vision. Okay. It's a very tiny spot. And in this tiny spot, there are specific cells that help basically make light into vision. And it's very concentrated. And this one spot is so tiny, and it is the only spot in your whole eye where you actually get that classic 20/20 vision from.
Mm.
So
Wow.
if this tiny, tiny spot, its integrity, ages not well, if those cells get damaged in any way, those light rays unfortunately do not go the way that they're supposed to go, and we quickly lose vision. So macular degeneration is basically the aging of those cells where we lose the cell function. And as a result, we lose vision. And that vision can be very quick because, as I said, it's a highly sensitive area of our retina. It is typically age related. It's one of the number one causes of blindness. And the age is roughly in that 60 to 65 category. And the risk factors are quite a few. And the part with macular degeneration, in terms of risk factor discussion, a lot of the risk factors are lifestyle. And a lot of
Mm.
people don't even know that. So, and that's crazy, right? It's crazy to me that we don't proactively discuss it as much as we'd like to. Obviously, we're constantly talking about health and wellness, obviously, in our spaces more so than maybe other medical spaces. But there really is not a higher level education of what keeps your eyes healthy. And it's time to kind of break that barrier and start being proactive. And women, as I said before, do have a slightly higher incidence. There's really two types of macular degeneration. Arguably, there's slightly more, but there's two types. One that is called dry and one that's called wet. Wet is basically a fancy word for saying that there's bleeding. That's the worser version.
Jeez.
And that causes extreme vision loss versus the dry counterpart, which can cause, let's just say, slower vision loss. Somebody with dry can convert to wet. That's something that we're always watching. That's why we constantly check these patients. And there's, again, risk factors that can help prevent dry from wet, that we want to be proactive in educating our patients. That wet form also is slightly higher in females than males.
Is when you refer to the dry, is that somehow connected to dry eye? Is that one of the same?
So absolutely not.
Okay, because I had dry eye. I just wanted
Okay.
to make sure. I'm like,
Yeah. So let's put it this way. Your eye exam revealed some conditions on the front of your eye.
okay,
We're talking about the internal back of the eye.
okay.
Okay. And so this is something that from what I knew, it's like just something that, oh, it's bad luck. This happened to you. You had genetics, maybe that one day you just got macular degeneration. But what I'm hearing is that there are perhaps some lifestyle factors that influence it. And so I guess how would you know if you were at risk for it? Like, are there any symptoms that you would be having?
So to come in complaining about macular degeneration is probably something that we don't want.
So you're really far along, you mean, if you're doing
Keep
that?
Wow.
not far along, but something already happened. I
Okay.
would say in terms of vision as a whole, the goal is, as I would say, like every eye doctor, the goal is to not have symptoms,
Okay.
right? We want to find it before you start complaining. We want to see the early signs before you start complaining. But
Can I pause there for a second? Now, when you get an eye exam, just like, for example, the eye exam that I had with you, is that part of a routine eye exam where they are looking for that specific macular degeneration?
1000% yes.
Okay.
So I would say, obviously, I dug really deep in nutrition and functional medicine.
Yes.
And I always say I do everything for like selfish reasons. I had my own health scare at the age of 31. It put me into a weird place of like, what's happening to me? I don't have answers. I would say the typical functional medicine timeline of a practitioner. Something happens to you, your family, and now you're vested in this new way of seeing health. And that kind of sparked my interest in functional medicine because I did it for personal reasons. But even a general eye care provider, optometrist, ophthalmologist, we are not even doing the basics
Mm,
for routine screenings. We're not going to the eye doctor enough,
right.
period.
Right.
So, yes, there are risk factors and there's things that will be tested in your routine eye exam that will show, if you have high risk, low risk, no risk for things like macular degeneration and glaucoma and dry eye and other optic nerve disease and vascular health of your retina. So,
Right.
we're supposed to check everything. Now, going into the nuances of nutrition and lifestyle medicine and those types of conversations, that's where I find my value becomes different. If I had like a wish today, it would be for everyone to properly get their eyes checked
Right.
by a professional proactively.
Yeah, and I have to confess that, in the first one of the things that was revealed was when you asked me when was the last time you had an eye examination, and I had to think about it. And because like the difference between Kristen and I is like Kristen says she goes to see an eye doctor regularly because she has what do you have, Kristen?
I'm nearsighted, so I needed corrective lenses or glasses to see. So I literally have to go every year to get my prescription renewed. So
Mhm.
I'm kind of like in that category of I have to go, but I
Right.
could see right where if you didn't have that, you might kind of forget about it or
Yes, and that would be me where, I get readers, but I can get readers at Staples, like I can get readers anywhere and otherwise I'm fine. I can drive, I can see, like it's all good. And so really it was such an eye opener for me yesterday in my exam because that was one of the things that you talked about, and it's like you cannot replace your eyeballs. Like if I missed a dental appointment, to your point, like, I got to get an implant. I can't implant an eyeball. So that really struck home for me. And then also when you talk about the nutrition, like you gave me a whole supplement like regimen, gave me like the script, I mean every single thing, and that was like really amazing. I've never in my life had anyone talk to me about supplement and like nutrition concerning my eyes and all of that. So that's a
So
game changer.
And that's, I mean, going back to Kristen, that you're proactive because you kind of are forced to, right, in that system. But we have such a huge population that they don't really need glasses much, or maybe they have a small prescription, so it's not really like a high level on their to do list. But a lot of ocular conditions don't need symptoms
Right.
to have the condition. And that's everybody thinks your visual acuity, your vision is equal to your eye health. And it's
yeah.
not. And especially in the aging population, especially women, we know we have higher incidence of things. We have more different comorbidities as going back to autoimmune, et cetera. If we're not proactively checking our eyes, because those things also increase our risk factors of ocular disease, then if we wait for some sort of visual dysfunction to like push us there, have we lost some time? And the answer is always yes. Even with you, Raquel, like if I had seen you maybe 3 years ago, maybe I'd say, oh, listen, your dry eye is at stage, etc. And
Right.
let's start implementing these few things for prevention. Let's start wearing the UV protection. All of
Right.
the things that we discussed, maybe it wouldn't have been zero in terms of what I found, but we would have been
Right.
able to perhaps prevent it more. And also, there's plenty of studies that have been released actually recently. Even dry eye used to be a syndrome, now it's a disease. We call it dry eye disease. And there is so much research in dry eye. I have to say, I am floored with the amount of phenomenal research that comes out with dry eye disease. So much, and I'll give you guys a great society to refer people to. And but a lot of patients in that category, they tend to wait. So it's like, oh, my eyes are a little irritated sometimes. I'll wait, push it off. I'll
Yes.
maybe do something myself. I'll get something over the counter, or maybe I'll,
Yep.
grab that Visine, which is the worst thing that anyone can pick. And I'll wait, and then I'll wait again. Right. So we're seeing that even in something as very common as dry eye disease, people are waiting too long too. They may not go blind from dry eye disease. I mean, that's not a common trajectory, but the cornea is highly innervated. It's one of the highest innervation tissues, your cornea, than any other place in your body. When your eyes are irritated, your quality of life technically goes down. It doesn't feel good.
No, it doesn't. And you feel like something because that everything that you're describing is me. Like I've had dry eye. I thought I wasn't sure. I thought that possibly I'm going to be blind soon. At a certain point, because my eyes were always itchy and they hurt, and especially my left eye. I was telling you that in our eye exam, and I would cover the eye like to just let it rest. I'm like, what am I doing? I need to go see an eye doctor. I'm like, something is, and it's true. Like, I was like, well, I feel better, then I don't feel better. But it definitely affected the quality of my life because I knew something was wrong. And I also felt like, what are they going to be able to do? Like, I'm just like, wow, like, what is happening?
There's a lot we can do. And then in the dry eye category,
Yes.
I
Which
have
I
to
found out
say,
after.
yeah, and I
Yeah.
have to say it's like a renaissance. We have so many tools to help with symptoms of dry eye, to dig into root causes of dry eye. And, we have to be proactive to screen for it. And also we have to be able to educate our patients that, listen, this is not something you just live with. Somebody's got to see you. There's things that can
Right.
be done. We
Right.
could help it from getting worse. And yes, a perimenopausal woman, I have to say, like when back in the day, I don't know how many patients I've seen in my career. I don't know what the number is, but I've fallen, and this is probably a pre-functional medicine training and all the other training, that typical patient walks in, my eyes are a little dry. And I've had that conversation like, how are your hormones? And it's like, oh, they're kind of weird, like female hormones. And then my next conversation is, well, that is one of the triggers for dry eye. And then the conversation ends where I'm like, okay, we're going to do this, and have a nice day. I do not do that anymore because I think we need to be very supportive of these women
Right.
and actually, I don't want to say like empower them because now going through perimenopause myself on top of all the education, saying dry eye is one of the major symptoms of hormone fluctuation. And it's like, what else is happening to you? What else are you feeling? What else are you experiencing? Have you seen anyone for those things? Are your doctors helping you, supporting you? And that is so imperative for
Right.
even people that are not doing hormone treatment or, various ways to support the hormones to be a part of that conversation and make the woman feel like, hey, I can investigate this further. There are more options for me. There's a level of like, empathy where it's like, I feel like you're suffering. This is just one thing. It's usually just one part of their perimenopause, menopause roller coaster ride. So that's another part that I found that has changed for me where if they need other forms of support.
Right. Right.
And so when your estrogen drops, is that when you're more prone to the dry eye, or is it other hormones involved as well?
So this is the crazy part. There's studies, human tissue studies, okay? We have androgen receptors, estrogen receptors, progesterone receptors in almost every ocular tissue. And on top of that, some of these like testosterone receptor sites for dry eye, for example, not only have the receptors, but they also have like an enzymatic conversion to DHT, which is like the super testosterone. So, what is it doing there, right? It's
Mm.
doing something. We even have testosterone creams, topical, that have been shown to improve dry eye on the eyelid itself.
Wow.
It
Interesting. Wow.
That
Yeah.
is crazy.
isn't that crazy? The exact pathophysiology of all this, like what is it doing? How is it doing it? That is not a well concluded type of assessment. But absolutely, we have all these receptor sites. We are pretty confident that when a woman, clinically speaking, goes through the roller coaster ride of, because in perimenopause, it's not like your estrogen just drops, right?
Hmm.
We know it doesn't. It goes up and down.
Yep.
I always say my roller coaster ride patients, especially the ones that have really symptomatic perimenopause, they tend to complain more. And I've had the exact opposite where I'll see like a patient record from like 2 years ago and whatever, they skipped their 1 year assessment. And the 2 years ago, it was like my dryness, there was, and then they'll come back in and I'm like, how are you feeling? Oh, I felt that way. I don't know. I guess I'm okay now. So what happened in those 2 years? Well, their hormones like stabilized where they went
Mm.
from like the roller coaster ride to stability zone, which
Sure.
we know is like,
I'm in perimenopause. I'm 48. I swear my vision changes like by the day sometimes. Like one day it'll be clear,
Yeah.
another day it's not as clear. Is that
yeah.
my imagination or do you think it's real? Like,
Probably not. I like at this point in my career, like when people say things to me, I'm always like, if I can't give you the answer of why it's happening, I'm not going to tell you it's just happening. Like it's in your head. Something's happening.
Right.
I just may not be able
mhm,
to explain it.
right.
Right.
So I'm not going to say that you're not,
Yeah.
that you're, but absolutely. So one big symptom, and we'll keep it on the simple terms right now. One big symptom of dry eye disease is blurry vision.
Ah, interesting. Okay.
You would never think that,
No, you wouldn't.
and especially in contact lens wearers.
Okay.
So that can be one
And
of
that's
the fa
me. I'm a contact lens wearer.
Yeah, so, I mean, again, we're not gonna go digging into your
Yeah.
ocular
No.
history here, but you can totally be having dry eye. Dry eye is not like this.
What are the symptoms of dry eye?
Tell us all the symptoms. Yeah. Hmm.
Well, there's a long list, and
All right,
this is
maybe the
where
top 5.
so, tearing. So, I'll give more of, like, the
Okay.
debunk. So, tearing, everyone thinks doesn't mean dry eye because, "Oh, my eyes are tearing." They're
Right,
wet.
why they're not dry.
But it's the opposite, so it's your body trying to compensate.
Hmm.
So we have basal tears and then we have reactive tears. So that dryness triggers your nerves, etc., to now do a different type of tear to kind of cover up the dryness. But that is not a natural tear. So your body trying to fix itself, but
Right.
it's not doing it well because it's not actually fixing the problem. It's just kind of masking it. So tearing for no reason can be a dry eye symptom. Blurry vision is actually misconstrued all the time
Mhm.
because the tear film, when you think about like how light works, light has to go through all of all of the ocular tissue through that organ to register to the back of the eye. The first thing light has to hit is not even your eye. What sits in front of your eye? It's your tear film. So if your tear film is scattered, I always compare it to the windshield. If you have a scattered tear film, it's going to be a little blurry.
Mm,
So blurry vision is a big one too. Gritty, sandy feeling. So, what you would typically think of dry, like my eyes feel like the
right.
desert.
Hmm.
Itchiness can be a sign of dry eye. It could also be a sign of allergies, which also increases dry eye symptoms too. I would say the top few that I would just kind of like quickly go, give as a tip.
Right. And I hit all of those 5s. I hit all those 5s.
And so I think I definitely have some of them. So if I'm thinking I have this, what would you recommend doing?
So the first is to get a dry eye workup. Obviously, sometimes it's part of the like, routine eye exam where we would check some general things for a dry eye, basically seeing if you're at risk for dry eye. But if it's a little bit, you may have to go a little bit more in depth at a follow up visit and looking at certain parts of your eye. So we always have to look at the eyelids. So the glands in your eyelids produce oil. Two, help the tear film stabilize. Because ultimately, the tear is made up of different components. It's not just water. And that's why all of these things are actually also hormone influenced because mucus secretion, oil secretion, which is a part of like kind of like your skin. So your eyelids actually secrete this oil to help stabilize the top layer of your tears. We
Mm.
have the aqueous and the mucus. So somebody would want to look at your eyelids, see if your oils are actually producing well, if the clarity of the oil looks good. Does it look like olive oil or more like a butter consistency? And then looking at how quickly your tears evaporate. Is it fast? Is it average? Looking at your corneal integrity. Cornea is that front surface of your eyes where you put your contacts on. Are there any dystrophies, we call it, anything that looks odd in the cellular pattern of your cornea that can also be triggering some of this dry eye feeling? So we have to kind of investigate a lot of these structures in your eyes, and some of them are done with machines, photography, drops, like staining drops that show us how your tear film pools. And if there's areas that your cornea looks like it's already being slightly damaged, we call that keratitis. And formulating after, assessing all these diagnostic tools. And again, dependent on the patient, which tools that you may or may not use and how advanced your clinic is, formulating like a plan.
Mhm.
And that plan is now, hey, your oils look like so. We need to support the oil
Right.
doing whether it's IPL.
Well, like for me specifically, because I had dry eye, and you
You
gave
have
me
dry
like
eye.
the drops that I have
Yep.
to do, and you gave me, I have the script and I have to go get the things, but then also the vitamins
Hmm.
that I have to take. And so you gave me a whole script of things that will help also because I have some irritations in my eye.
Correct. And also you have allergies. So it's like
Yes.
you have multiple things. And a
Right.
lot of people with dryness, there is usually, it's called a multifactorial condition. That's kind of like the buzzword. And I always say with dry eye and honestly, all types of ocular conditions, the out to in to out. So are you hitting certain dietary patterns that I know are going to be supportive of it?
Oh, that's right. Eating salmon twice a week. That was one of the things. Yes.
Are you taking in fatty fish
Yes.
to help support your net omega-3 levels, your DHA levels? Are you having enough something called carotenoids? Now, carotenoid is a very, very important factor in eye health, and that is not talked about enough, which is really the two things is called lutein and zeaxanthin, which we can discuss further for other parts of the eye too. Vitamin D levels are imperative
Right.
for dry eye. So there is that element of what I look at in terms of in to out versus out to in. And procedurally, not everyone does that always. We've
Mhm.
gotten much better with that as a profession, as a whole. But yeah, I'll give you a little extra pointers that maybe someone else who doesn't have nutritional background that may not. But ultimately, if we don't want to keep waiting, the whole goal right now with dry eye disease is to really start prevention. There's even mites that can grow on the eyelash line that a lot of people don't know. It's very common.
Wow.
Yeah, so that can cause dry eye. There's all these elements that if we're not being proactive and
Right.
treating, that years and years.
Escalates.
Correct. Rosacea is a
Yeah.
huge connection to dry eye, and that can also be triggered by, guess what?
Really?
Perimenopause and menopause. So we see
Mm.
a big change in our skin during these aging years, and skin affects your ocular surface too.
Right.
So I think, yes, I wish I saw you maybe 3, 4 years ago, Raquel,
Better late than never.
but it's better late than never. And Kristen, it sounds like you need a dry eye. Walk up.
Well, and this is a good message for people.
Yeah, it is.
Yeah, I think I do, and it's funny because in my regular exams, I feel like this isn't really discussed much. They say,
Mhm.
"Oh, how are your contacts feeling? Do your eyes feel dry?" And I usually say, "A little," and then that's, like, kind of where we leave it at, so they
Yeah.
might be doing things that I don't know that they're checking, they probably are checking certain things that I'm not aware of what they're doing, but this is a really good awareness.
And also, sometimes you don't complain about, oh, my
Right.
vision goes in and out sometimes.
Right, because I agree with Raquel, you kinda just think, "Oh, what could they do about it anyway?" You kinda just
Yeah.
ignore
Yeah.
it, which isn't good. at
Yeah.
all. But
They'll
And
figure it out when I look at the eye chart and I have to pick out the Z, the Y.
I would
They'll figure it out.
and that's so funny you guys say that because one of the foundational things that I've learned in functional medicine is literally if I don't see a patient and I do a full on functional medicine assessment, and I haven't even seen them yet, I haven't talked to them, and I have that like 20-page history thing that is a little bit, that's a different program I have, but 20 pages of medical history and questions. A lot of times you start seeing patterns without even seeing the patient. So complaining is good. Talking
Yeah.
about all of your symptoms is a good thing. Don't hold back because that actually, that one sentence that you're like, sometimes might be the trigger or the pointer for the clinician to start investigating something slightly differently.
Got it.
History is very important.
that's a good point. Yeah.
That
And
is a
as
very
a
good.
patient, it makes me think I really should take some time to collect my thoughts before I go into an exam because sometimes I'm just rushing in. I'm not thinking about all the little things maybe that might be bothering me, unless it's something major where you're like,
Of
okay, this is
course.
really bad. You just don't think about it. So I think it is a good chance to kind of, think about how your daily life's going.
Yeah, and I would say that for all practitioners in general. I don't think
Yeah,
anyone would say no to that. Like, we want to know what's wrong. We
right.
wanna hear what's happening. The more information you give me, the better I can create some sort of plan or at least investigate your condition better.
I gotta say, listen, like I mentioned before, I'm 58. I've had many eye exams in my lifetime. I gotta say, like the thoroughness that you had when you examined my eyes, I mean, there were things that you did that I've never had anyone do. Like you said, maybe you have obviously you have more state of the art, like not that obviously, but you do have state of the art like machinery and stuff. But also like when you're looking under my eyelids and lifting up my eyelids and looking in the thing, and no one's ever done anything like that. I've never had. Have you ever had Kristen, anybody, like, lift up your eyelid and look underneath your eyelids and stuff? Or take a photo?
No. And this is the first I'm ever learning how the eyelid has an impact on your eye health. I mean, I had no idea. Like, I really didn't know that until today.
Right, and also when you took the picture of my eyeball itself, that looked like when she showed me that on the monitor, it looked like a Halloween picture, but anyway. But I think that's really honestly, it's changed my whole perspective because prior to walking in, honestly, I was like, I was doing the session with Dr. Neda because I thought it'd be interesting for the podcast, to have some of this insight and really it'll bring a little more dimension. And, that was really the idea. In my mind, I'm like, yeah, my eyes are a little itchy and they're irritated. But, I mean, outside of, giving me a new prescription, I mean, I don't know what else can be done, right? That's what I'm thinking, but I have to say, I feel like a new woman after I left there. I was like, wow, there are actually things that I can do. There are supplements, there are foods, there are things that I can do to help make myself better. And I'm definitely going to report back on this because I told Dr. Nether.
I was gonna say, can we break down, like, the nutrition and supplement thing for people, like, with
Yeah.
eye health?
Yeah, so that is a very good topic, and that is something I've been doing for a long time. I think supplements are, we always talk about supplements, right? It's not a replacement of lifestyle. Okay. So, with that being said, I am very proactive in my supplement recommendations, but also gauging like who the patient is, what they're already doing, how they're eating. So that is never like two different like conversations. You have to take both into consideration. And that's even without testing, like lab testing, which I'm very much of a proactive in. So supplements, we have going back actually to the conversation of carotenoids. I would say carotenoids are one of the top type of supplements to take for the eyes, specifically two, called lutein and zeaxanthin. And they're horrible words. And I hate that because no one, I'm like, can we change this wording? Because then maybe we could, try to motivate people to take it and eat it more proactively. So it's found in our deep green leafy vegetable foods,
Mhm.
our bell peppers, egg yolk, it's yellow because of that lutein. So we find it in nature and it's really, it's concentrated in the eye. And it's actually found in multiple places in the eye, concentrated highest in the macula, that place that we have the best vision. And lutein and zeaxanthin at a certain ratio. Now, obviously, there's some people that might say 20 milligrams of lutein is too high, but let's just say standard of 10 to 2 milligrams of zeaxanthin or 2 to 4 on a daily intake. Now, if you're eating tons of vegetables, tons of, the rainbow foods, you may not need it, right? But I would say that is one of the biggest supplements that we try to support with our patients, whether it's eye disease related or proactive. I say for my really high screen time people, because blue light gets mitigated by lutein and zeaxanthin as well. That's like our natural blue light filter, let's say. Yeah. And, we have to talk about children and who don't eat their vegetables.
Mm.
And we want to be proactive in kids too. Obviously, supplements are not my highest priority in kids, but supporting that lutein and zeaxanthin intake. And then I would say vitamin D is actually really important. Vitamin D does so much. It's a prohormone, immunomodulator, anti-inflammatory, all the buzzwords that are like eye health galore. And we have so much research that supports vitamin D, proper vitamin D levels with ocular disease support. And dry eye is definitely on that list. Vitamin C actually has some of the highest concentrations of vitamin C's in your eyes, in your whole body. Is that
Really?
crazy?
Wow.
Yeah, because your eye is really fast acting. There's so much information going into your eye, and it has to actually process it. Light
Right.
is a big process. We use a lot of ATP. We have a lot of reactive oxygen species that happen from all of these enzymatic things that are happening for us to see. We have ultraviolet that goes in there and it has to get mitigated. So there's a lot of action. Some of the highest mitochondrial turnover is in the eye because of these fast acting cells. So vitamin C is imperative. It's like a great antioxidant, right? Glutathione, which we know is the master antioxidant, much harder as a supplement. So we won't get into those specifics. Vitamin E is found to be supportive as well. I like, the mixed tocopherol, vitamin E. And I would definitely say the omega class of fish oil, so DHA in particular. DHA is typically brain function. Eye is brain, right? Your retinal health, although in some studies show it doesn't really make a difference, we know that we need proper DHA in the eye, regardless whether it's in the front of the eye, the back of the eye. So we want to have a good, robust intake of omega-3 DHA. And that does go into nuances of what the supplement is, how it's manufactured. Once we get into the conversation of fish oil, we go down the toxicity, toe tox scores, and a lot of nuances there. And that's where I always am, I'm proud to help my patients kind of navigate what's good, what's not good.
I was going to say, I mean, you see a lot of commercials on TV. Take this supplement, number one eye doctor recommended. Like, but I have no idea where it's sourced or what exactly it is. So
Yeah.
I'm wondering, do you recommend specific eye health supplements or are these just combinations of different vitamins?
Yeah, so this is obviously more of a general, like, what are some of the vitamin classes or
Hmm.
nutrient classes that we're looking at? But yes, so there is, we have different certifications for vitamins, GMP certifications, all of these things that have nothing to even do with eyes, right? It has to do with
Hmm.
general vitamins as a whole. Yes, I have like a punch list of my favorites, which I'd be happy to share. I could like type it out for you.
Awesome.
And I
Okay.
think that
Yeah.
that might even be better
We
than
could
me
share it in
verbally.
the comments below
Yes.
because I think
Yes.
people really would
Yeah,
appreciate that. Because I
yeah.
found it really hard. I mean, I have to admit, even I asked my functional doctor about specific for the eyes, and she didn't really have a ton. And I don't have great eye health. So it's something I'm concerned about. So that's great.
Yeah, and it's twofold, right? So that's kind of why I ended up creating the service of Eye Exam Plus. So that's where you give me what you do.
Hmm.
Show me what you're doing. Like, I want everything. I want the list. I want like a 1-day journal. And then I look at your eye condition, whatever we're talking about, and I try to also find out maybe you're already taking something good,
Right.
right? Like,
Yeah.
what's the dosage? What's the type? What is the formulation? We'll keep that the same. Let's minus this, add this. And that service was one of like, it sounds so stupid and simple, Like, of course, but it actually was so impactful because when you sit back, you're like, so many patients are confused about what to do. And now they're
Yeah.
taking something for something else, right? They're
Yeah.
seeing multiple practitioners or they're doing things on their own research. Who is looking at it all together?
Right, exactly. Yeah, eye health is always put in, like, a different category or something, I don't understand why, but
Yeah.
now that
And
you're
I've seen
explaining the nutrition
errors.
connection and yeah.
Yeah, I've seen errors where people are taking way too high beta carotene, which is like a precursor to vitamin A to some degree, but it also at really high doses can impact lutein and zeaxanthin absorption.
Okay.
So the
Mhm.
patient's thinking, I'm like going great with my beta carotene. And you're like, wait. This dosage is like so high. And no one's checking it. It's
Mm.
like,
Right.
of course, I try to always look at everything with a functional lens and assuming they have some primary or a general physician that's being
Mhm.
proactive, but that's not usually the case. At what point are they going to find a practitioner that's willing to do that for them, or at least help navigate how to translate all these supplements they're taking and some dietary restrictions and dietary inputs that they're missing? I've had patients who literally, like, I eat fish all the time and I run their omega index. And I'm like, wait, your omega 3 is still really deficient. What kind of fish are you eating though? And it's, they're thinking they're doing everything great. And they are to a degree, but it's like, we could be even better. I could optimize this by you picking these types of fish versus these
Mhm.
types of it. And that's where, the way I practice is obviously slightly different, but the goal is to continuously support practitioners that want to go down this road and learn more about the functional health behind eye disease and eye support and be proactive with their patients. And we're seeing an increase. Like, it's not fast, but there's
Yeah.
definitely an increase. And more so being proactive in people who are changing in their lifespan, like our perimenopause patients or menopause
Yeah, I
patients.
think this is really getting more attention. I had never really even heard of dry eye until I started hearing about perimenopause, so it's definitely getting more attention. And so we wanted to ask you, what about cataracts? Is there anything you can do to prevent that?
Right, because I was gonna say that's another thing that I think aging women worry about is because that's
They
what you
do.
think about. You think cataracts, you think,
Yeah.
an elderly person.
I was told I already have them, like, or it's
Oh,
coming.
yeah, that's
So,
right.
yeah, in my eye exam.
Cataracts is a natural part of life. Okay, so first let's put it under that category. It is a natural part of life where the lens of the eye starts to age. The lens sits behind the blue or the iris, the blue or the brown of the eye. And from years and years of oxidative stress, the cells in that lens start to go from clear to more opaque. So that oxidative stress changes the cellular, basically, transparency. And due to that, your vision goes down, okay? Because you can't see through a foggy lens. You have to see through a
Mhm.
clear lens. Now, going back to women, and so we know that there's receptors, there's hormone receptors on the lens as well. We know that ultraviolet light exacerbates this oxidative stress. We know that all the things that increase oxidative stress changes that cellular function. So anything that ages you, like smoking is a huge one for advancing.
I was a social smoker. Yeah, like, yeah.
It's huge. It adds up, or even
Mhm.
secondhand smoke, right?
Mhm.
Smoking is also one of the top risk factors for that macular degeneration thing that we talked about too. It's a huge one.
Mm.
So that oxidative stress, what has the patient done or is doing that's putting oxidative stress on the eye, and the lens basically ages faster? We can't stop it from aging. It's going to happen. So that's why we have patients who have cataracts who are like getting their surgery at 95. And then we have some that are 60 or even younger.
So, is there a genetic component? Because my dad was just telling me he has to have cataract surgery, and he has very bad vision. I think I did get his poor vision or something like that. Yeah.
Absolutely. There's a genetic component to almost all ocular conditions have some sort of genetic component. But as we know with epigenetics, we have
Mhm.
drivers and we have slowers, right, to that gene expression. Cataracts, it doesn't have to be genetic because everyone does get cataracts to some degree at some point in their life. So it's not like, everyone's great grandmother had cataract. Now, if they needed surgery, that may or may not be always the case, right? But yes, if your family tends to get it a little bit younger than the average age, then you might get it a little bit younger. But not to say that you can't do things to kind of combat that.
Mhm.
Really?
Yeah, like going back to vitamin C, right? All those antioxidant foods that we take in does have impact in your lens as well. Ultraviolet protection, sun protection, like real sun protection, UVA, UVB if you're like a beach goer, you're a boat person, skier, all that adds up.
So I have to ask you about this because there's a lot of influencers out there on Instagram. I don't know if you've come across this. They're saying ditch the sunglasses. You need to be getting the light in your eye. That helps your mitochondria function. And so what's your thought on that?
We have too much data to show that people can go blind from too much sun. Okay.
Okay. Mhm.
So, and it changes the skin on or the surface of the eyes. So,
That's what happened to me, by the way. That's one of the
correct.
things that Dr. Neda saw was that I had a bump or some that is
From
from a sun.
ultraviolet.
Yeah, it's from sun damage on my
Correct.
left eye, and my left eye is the eye that I always feel like a lot of pressure and like an irritation and pain, and it gets worn out.
Yeah, so we have a lot of, clinical data that shows like too much sun damages the eye. And it's because it's ultraviolet is not healthy all the time. I would debunk that in the sense of if you're going outside and you're literally like bathing in the sun for hours with no protective anything, your risk factors for a lot of these eye diseases that we just discussed went up by a lot. Now, do you need to be in the dark all the time and have 0 sun? So I think it's getting misconstrued.
Right.
Right now, the problem in our societal issue right now is that we have too much indoor time, period. So we're too constantly indoors. So being outdoors in and of itself is helpful, but I don't think you need to not wear sunglasses ever to get the positive effects of having, vitamin D release and your circadian rhythm being supported. And yeah, maybe walking around without sunglasses for a little bit is not the biggest, problem, but it's yeah, like soaking your eyes in the sun for hours upon hours is not something that is a positive thing.
Right. It's not an all or nothing mindset, I think, in this regard. Is I feel like what you're saying is like, listen, you want to do the circadian rhythm, go out with the first break of light or whatever, get a little dosage without your sunlight, get that, and then put your sunglasses on throughout the day. And like,
Yeah.
it's not an all or nothing. It's like,
We just have such extremes, or I feel like,
yes,
and especially in social media, you really see the extremes because everyone's trying to make a statement and
Yeah. And it's a buzzword. You click it, you're like,
yeah.
oh wow.
Oh, wow. Yeah.
But I mean, you ask anyone, ultraviolet rays, excessive amounts, it's damaging. Like, we know this. We see it in our skin, we see it in a lot of parts of our bodies. So, yes, there is a balancing act there.
yes.
And I would say most eye professionals would definitely say that ultraviolet protection does help with aging of the eye.
What about red light therapy? Can red light therapy improve eye health and vision?
So the short answer is yes. The long answer is we have some really cool research coming out, procedures coming out. I would say I am not ready to give like the ultimate protocol recommendation for this, but I will say very soon there's a lot of standard of care we're going to see in this category in terms of eye health and eye disease management and just there's so much happening. Mitochondrial support,
Mhm.
right? So going back to that, oh, the eye has so much mitochondria. Well, wouldn't this support that, right?
Yeah.
So right now, though, it's a little bit confusing, like what nanometer, how long, how, what. And I know for a fact that this is going to be some really good research based sound recommendations coming. And
Exciting. That's really cool.
it's already slowly yeah, and as I said, like, the eye health and eye treatments and what we can navigate with ocular testing, we're legitimately in a renaissance phase, where it is coming out so quickly that
Wow.
it's not the same. I mean, if I went back to school, like, right now, I would be, like, lost if I didn't keep up with everything because there's so much medical advancement, whether it's functional, because even the red light therapy and all these new lasers and some of this is, like, standard of care stuff. We're not even talking functional medicine,
Mhm.
right? But there's gonna be a lot more of that bridge between the 2, and I'm seeing it in the wellness sector as well, how it relates to eye health, and on the flip side, I'm very fortunate to be able to be involved in both sectors, like, separate places, whether it's conferences, thought leaders that I speak to. And it's really exciting. I've never seen this.
I know. So we have so many questions for you today. We're getting a little tight on time, but I definitely wanted to ask you about PFAS and plastics in contact lenses. There were some studies that came out. And of course, I was really upset because I'm like, man, I've been wearing contacts since I was 17 years old. So
Yeah.
is that something to be concerned about? Are there better brands than others?
So the funny thing you asked this, I literally just finished a teenage patient and his mom, and we had the same conversation. So, yes, there is an awareness situation right now where certain products have higher percentage of this type of plastic within the contact lens, and it is becoming a very big awareness factor. There's products that might be better than others that are being even tested in the first place, right? I would say this with some confidence, and this is what I told mom. The reverse systemic absorption of it, I am not really highly concerned right now. Obviously, it's sitting on the cornea. So it's like, what is it doing to the corneal tissue? That's more of my investigational questioning versus like, am I getting it at a high dose in my whole body?
Okay. All right. That makes me feel better.
I'm not losing sleep.
Yep. Okay.
Over it, and I use the contact.
Yeah.
Something that I definitely want to cover before we let go, because we had this conversation yesterday, and I think that a lot of people would like to know this. When I talk to you about the blue light blockers, like, so for example, like right now, I wear these. Now, I don't know if it's just like the placebo effect or something, but I feel like they do help me. Like, I feel like it gives me some relief. And since I started wearing them, however, I also understand what you explained to me yesterday, where I was like, it's a big aha moment for me, where you said that these blue light blockers are not required by, like, what is it, like the FDA or something,
There's
to
no
have
regulation.
right, there's no regulation. So, but there are blue light blockers that will tell you if they have that regulation. But if they don't, then it's probably like whatever. Is that right?
Yeah, in a nutshell. So blue light filters and there's blue light block. So block is like very aggressive term. So it's like what we talked about before, Raquel, where it's like literally like there's almost no blue light getting in, and you usually have like the amber, really heavy tone.
That's like Dave Asprey wears that, right? Yeah.
Exactly.
Yeah.
So we have blue light, we'll call it reduction. Okay.
Okay.
Glasses, blue light glasses. So there's zero, like the verbiage is you could make up whatever verbiage you want. There's no regulation. It's not like FDA checked or anything. Ultraviolet is, by the way. So you're kind of
Mm,
guessworking. So you don't know what percentage of blue light is being blocked or reduced, how much of it, what's the amount. So that's the first thing. So the companies should share those values with you, or at least have something where they have third party testing and they're able to articulate, hey, we do that, like our coding does this. So that's
right.
the first step. And then absolutely, it can reduce, we call it asthenopia, which like it's like you don't feel so good because, as I said, blue light does penetrate the eye slightly differently than the other visible light spectrum colors. So reducing it is not, it's people can feel better. Yes,
Okay.
there it doesn't always have to be the placebo effect. It's really the talking about eye damage and circadian rhythm. And as we discussed, the eye damage part, we do not have any valued research on that proves that it damages your eye versus like if I stared at the sun directly, I know that's my damage. It's going to be damaging. So
Okay.
going back to that, I would say if it helps with a good blue light vetted company, then great, you feel better. I do like it more at the end of the day
Yeah.
to help support that circadian with artificial electronics. But I think I'm in the class of it's not for everyone. It doesn't have to be. I also think some of these filters have anti-glare on them, which that in of itself helps with computer feeling, not just the blue light.
Right.
So it's a nuanced question, but I would say the big take home is what is it doing and find out. Just because it says blue light doesn't mean anything.
Good to know. Yeah, because that's hard to navigate. I wasn't sure. And some of them are so much more expensive than other ones. So you're thinking, well,
That's exactly where you're gonna ask the questions, like, is this actually like, what's the nanometer like, how does this block blue light? Like, what does your third party testing show?
Mhm.
Great. That's great. That's a great question.
Okay, great. That's great info. So, being mindful of our time today, Dr. Neda, what are two things we can do today to improve eye health and age strong?
Oh, that's a great question. I think let's go simple. The
Yes.
simple is follow a Mediterranean diet. As basic as that sounds, that is one of the core fundamentals of ocular support, whether it's from the front of your eye to the back of your eye. Following a standard, classic, good Mediterranean diet where you hit all your vegetables, your fatty fish, your healthy fats, etc. That's number one. Number two, I would say outside, it's actually like I'll say there's a third. Number two, I would say give your eyes a break.
Mm,
So take breaks. For people who are constantly on computers, indoors, use nature to your advantage. Go outdoors, take visual breaks from what you're staring at. It does support other roles of the eye that, as I said, is not as black and white as the Mediterranean diet. And then I would say number three, the biggest problem right now is like, do you even know what your ocular status is? Do we even know what the health concern is in your eye? Because different parts of the eye may have different recommendations. So getting a routine eye exam,
yeah.
even if it's basic, is better than nothing. And especially women that are becoming of age, we have higher risk factors for certain ocular diseases, et cetera. And a lot of these don't have, as we discussed, major symptoms. So being proactive in your eye care is essential because then I can make those recommendations that we just discussed a little bit more
Right.
tailored to you.
Wow.
Absolutely. Well, thank you. This was such an enlightening conversation. I learned so much that I had no idea. And definitely, it was a longer episode than normal, but I think we got a lot out of this. So thank you.
Yeah,
Yeah, feel free to
absolutely.
cut anything out.
No, I don't think there is.
You can connect with Dr. Neda on Instagram. Her handle is at Dr. Neda Gioia at Integrative Vision. Also, visit her website, integrativevision.com. Thank you.
Thank you. Thanks, guys. Have a wonderful day and thanks for having me.
We need your support. If you're enjoying the show, follow, like, and subscribe. Thank you for Aging Strong with Functional Moms Podcast. The information provided in this podcast is for informational purposes only and is not intended for the purpose of diagnosing, curing, treating, or preventing any disease. We are functional medicine certified health coaches and not licensed medical professionals. The opinions and advice of guests are their own and also not considered to be medical advice. Always consult with a healthcare professional when making any healthy lifestyle changes. We would love to hear from you. Please leave a comment or review. Email us at info@functionalmoms.com. If you enjoyed this episode, please hit the subscribe button.